Hello. Many of you do not know me. A few of you do. But my name is Ken Huntington, and I live in Chicago. I'm 27. I started T in June. I'm here to talk about what to expect when you first start testosterone. Alright, I'm going to read you a paper that my doctor gave me of some risks and common misconceptions, because this is the kind of stuff that I wanted to know that no one ever talked about in their videos. So, alright, risks are liver problems, increased aggression, mood changes, balding patterns, hypertension, blood clots. All that heart and blood related stuff is because your red blood cells multiply when you're on T, meaning it's like thickening of the blood. So it's important to drink a lot of water when you're on T. Heart disease, heart attack, and heart disease, stroke, increased cholesterol, basically any of the problems that your dad has. You're basically a biological male now, so you have to deal with the same health risks as any male would. Possible increase of red blood cells and hemoglobin to dangerous levels. Risk of death rare due to the above named conditions or other unknown effects. Thyroid problems. My doctor makes me come back, every 3 to 6 months to get blood work done to make sure the thyroid problems are, not there. Acne, possibly severe. I've been waiting for it, but so far so good. I try to take care of my skin using, face washes every day, especially working in a factory. I'm surprised I don't break out more. A lot of guys just get crazy acne all over their back and chest and face, and so far, knock on wood, I'm keeping that at bay. Increased headaches, I have noticed a little bit. It's not a constant, but after the second week, right before I need my injection, I'll notice I get headaches. Infertility, birth defects, if you do become pregnant, diabetes, yeast infections, and that's because basically yeast infections can come from your hormones being out of whack, so that makes sense. Possible increased risk of certain cancers, osteoporosis. Guys, when you start T, you should start taking calcium pills every day, because you are more at risk of your bones becoming brittle and getting osteoporosis. Pituitary gland tumor. Now these are all common things, like when you start any medication, there's a huge list of risks, and it's not saying it's gonna happen, but there are things you can do to prevent these things from happening, like exercise, eating clean, taking care of yourself. Quit smoking, just do it. If you're gonna start T, be in the best health you possibly can. Alright, common misconceptions. Now, this is hilarious. When I read this, I was like, seriously? Alright, testosterone use will cause my breast to disappear completely. False. I will no longer need breast exams or pap smears once on hormones. False. And that's important for, anybody born with what we have. You should keep up on that. I will develop an Adam's apple and my jawline will grow. False. I have seen guys get a bigger trachea because T thickens your vocal cords, so that's odd that they would put that there. But the whole jawline growing thing isn't true. The reason why it may appear that your jawline is, more defined is because the muscles in your cheeks will grow. And I felt that. I'd be eating one day, I'm like, damn, my face hurts, and I realized that it's just those muscles getting thicker. Taking more testosterone will lead to quicker results. False. In fact, too much testosterone can be processed back into estrogen within the body and may slow results. So if you're not paying attention to your doctor, if you're not doing the correct dosage, it can actually have the reverse effect and give you more testosterone. I'm getting a phone call. Hello? Yeah, just get the high life. I'm like in the middle of a video telling these guys not to smoke and drink anymore. I'm like, yeah, just get a 30 case of the high life. Alright. Yeah, no, just get it. I'm in the middle of a video. Bye. Ignore that. All right. Oh yeah, it will have the reverse effect if you don't pay attention to your correct dose. My dose is 1 ml plus a tenth of a mil bi-weekly, and that is specifically formulated for my body and my blood and the way my body processes hormones. When you go start going to the doctor, they will make sure that the dosage is correct for you. So if you don't pay attention to that, you could be not only getting the reverse effect, but you can be hardcore messing up your body and your health. So don't be stupid. I will grow testes and a penis. False. Really? Jeez. I just thought it just magically appeared, and next day you wake up and oh hello. All right. Taking hormones will cause my bone structure to change. False. And I actually am guilty of thinking that before I went to the doctor too, because what happens is your body starts processing where to put the fat differently after you start T. So you start getting the V shape and everything. It's not your skeleton changing shape. It's the actual fat and muscles changing shape. I will be able to impregnate a genetic woman. Thank God for that one. Dodge that bullet. I will no longer be able to be impregnated. False. You still can get pregnant if you guys are with a cisgender male. Taking less tea will cause only some things to change. False. Hormones affect all areas of the body, even in small doses. Yeah, I've heard of a lot of guys being like, oh, well, I just want to do tea for, a couple months just so I look androgynous, and then I'm going to go off of it. You will be a man. Like, you can't just take a little. You'll be messing up your health. Once you stop taking it, your body will be in shock, and bad things could happen to your reproductive organs. So just make sure you're positive. You want to be on this for the rest of your life before you do it. There should be no doubt in your mind that this is the best path for you, and that this will be a massive improvement to your living condition. If not, there's no problem being pre-T, or being, natural and just bodybuilding, eating clean, having voice therapy to make your voice lower. Like, there's other options other than taking tea, for guys like us. So don't be pressured into it. Don't think that this is the only path to go. If it's, if you have any doubt in your mind, there's absolutely nothing wrong with not going on tea. And for years, I did not want to. Alright, so I'm going to talk a little bit about my personal experience when I started tea. First shot, I stopped my cycle right away. It's been gone since June. I've heard of some guys still getting it after 3 months or whatever, and then it just stopped. But after my first shot, that sucker was gone, and I forget people even have that. So it's pretty sweet. When I started, I wanted to see changes right away. I'm like, oh, I feel like my voice is changing. Oh, there's a hair. You just have to be patient. You won't notice changes until maybe the end of the second month. But I didn't notice anything mood-wise different. I noticed I had a lot more energy, crazy energy. I didn't really have any negative side effects. Things were definitely changing physically in multiple ways that I noticed, especially, reproductive wise, and those organs down there, things were happening second week in. I did notice that mentally and emotionally I changed since being on T. I process things differently now, and I have a harder time. I mean, to begin with, I had a hard time, but even now I have an even harder time understanding women's logic and where they come from when they're upset, and I process things in a more logical way. I still did back then, but even more so now. I'm just why are you crying? I ever since I started T, I was able to open up more socially, and I'm more confident. I can go to school now. For years I didn't go to school because I was so insanely dysphoric. I couldn't talk in public. I I was depressed and I just wasn't myself and I couldn't concentrate. It's all you thought about. So I knew that this was the right path for me. Yeah, you don't notice changes right away. You know, that's the thing you have to keep in mind. You just have to be patient and kind of just knowing that you're on T makes you feel better, you know, in those early stages. I mean, I'm still in early stages, only 7 months in, but I don't really know what else to tell you. If you have any other questions, I'll make a video, anything at all, really. I'm not, opposed to any subject, so thanks for listening.